The purpose of this presentation is to review some key issues from the required readings for Module 7, Global Health Actors, Who are the Key Actors and What do they do? And during this presentation, I'll be looking a little more closely at intergovernmental organizations, what are they, and take the examples of WHO and IOM. We'll be looking at civil society, both non-governmental organizations and social movements, and then also national governments as a global actor. So intergovernmental organizations. Intergovernmental organizations are made up of member states, and they consist of at least 2 or more nations working in good faith on issues of common interest. They can either be sub-regional, regional, or global in scope. So, for instance, one of you is looking at the DRC as your case study, and a sub-regional intergovernmental coalition called the Great Lakes Initiative is quite important. There's also regional intergovernmental organizations like the AU or the European Union, and then there are several global ones. All intergovernmental organizations have formal agreements on mission, on scope, on operations, on the responsibilities and benefits that members will receive. So they're actually quite formalized. One of the biggest intergovernmental organizations, which is actually a group of organizations, is the United Nations. And we've looked at this in various ways from various angles over the last several weeks. And several of you will be looking more closely at different organizations within the United Nations as part of your case studies. The 2 intergovernmental organizations that were highlighted in the readings were the World Health Organization and the International Organization for Migration. Let's look first at the World Health Organization. As the readings indicated, it was established in 1948 as part of the new UN system that was being created at the time. It has had several recurring priorities over the last 40 years: communicable diseases, health system strengthening, non-communicable diseases, preparedness, surveillance response, looking at health problems through the life course. And we've looked at a number of these issues as they pertain both to global health and to migration since the course began. WHO is usually thought of as having several different functions. It has a coordinating function, it has a collaborating and mainstreaming function, meaning that it wants to get health issues in broader governance mechanisms or incorporated into organizations that aren't specifically health related. It has a role in strengthening health services, providing technical advice, epidemic control. We're seeing that now with the coronavirus. It has a very important role in setting standards and negotiating agreements, and some of these agreements have come up in various readings over the past several weeks. The World Health Organization also has a number of very specific challenges that I just want to highlight. I have worked for the World Health Organization, so I know the organization quite well, and I've experienced these challenges personally. The first is around structure. As the Essentials of Global Health pointed out, there's a World Health Assembly that is a universal body that includes all the organizations, all the countries or the member states that form the World Health Organization, and an executive board, which is it consists of about 34 representatives of states that are elected on a rotating basis that actually do the day-to-day governing of the World Health Organization. So the World Health Assembly, supported by the Executive Board, are the global governance bodies of the World Health Organization. But it has a very complex regional structure. So take Africa, for instance. The Africa Regional Director of WHO is elected separately by the ministers of health or by the member states within the African region. So the African Regional Director of WHO is not appointed by the Director General of the World Health Assembly. He or she is elected by ministers from his or her own region. This has a number of knock-on effects, including that the African regional director, of course, will be respectful and should be following the directions of the Director General, but doesn't actually have to, because he or she is not dependent on the Director General for the job. The African regional director needs to please the African states. This is really an Achilles heel of WHO, and it has, as I said, has a number of effects. When I was working on HIV/AIDS with the World Health Organization, the regional director for the Arab states published a report advocating early marriage as an HIV prevention measure for women. Of course, this was completely against the policies of WHO as a whole, but took a lot of damage control and a lot of convincing and lobbying to get that report taken off the table by what is a semi-independent region of the Arab states. The second issue is funding. WHO has a very small level of assessed contributions. So if you're a member of the World Health Assembly, you are expected to contribute a certain amount towards the core operations of WHO. But the vast majority of WHO's funding are voluntary contributions. So it's donor governments or other organizations making contributions to the World Health Organization for specific disease control departments or specific initiatives, which makes it difficult for the leaders of WHO actually decide on what needs to be done as opposed to what it has funding to do. So this voluntary contribution dilemma affects a lot of UN agencies, including WHO. Staffing, vast majority are health experts, which brings us into the same problem we read about in earlier weeks, that often these health experts don't have the skills or the awareness or the ability to connect health issues to broader political, economic, and social issues. And roles, and this is really important. There are groups of countries that feel WHO should just play a normative or standard setting role. There's other countries that really want WHO just to be the provider of expert technical assistance. And then there are a few that expect WHO to be able to mount operations, for instance, in response to epidemics. And those of you looking at the Ebola spread in Africa some years ago will see that WHO, the regional offices and the operations of WHO had been drastically cut by donors shortly before Ebola broke out, making it difficult for WHO to effectively control Ebola. It was actually very late getting in really to the operations of Ebola in Africa. Médecins Sans Frontières and other NGOs were way before WHO. The second organization we'll look at was the subject of a particular article I asked you to read. It's the International Organization for Migration. It was first established in 1951, renamed in 1980, and then again in 1989. It was made a permanent organization in 1989, and as the article indicates, the history reflects the very complex nature of the migration issue. And among other things, the IOM has a complicated relationship with the UN. It was formed more or less by the United States because the U.S. didn't really trust what the UN High Commissioner for Refugees was doing, didn't want to necessarily be subject to what a big General Assembly of Nations would decide when it came to migration. So formed the International Organization Migration for very specific purposes. It was very separate from the UN for most of my career, did not adhere to or did not incorporate into its mission the Universal Declaration of Human Rights, for instance, upon which most UN organizations are founded. It has become a related organization to the UN in 2016. It will never be a full member of the UN until it accepts various modes of operation, which it hasn't yet. The key characteristics, as pointed out in the article, technical assistance embedded in a political environment, an emphasis on operational work, and a voluntarily broad mandate. And this relates to the challenges. The International Organization for Migration is very projectized. It's decentralized. It basically accepts donor funding for a wide range of tasks, which you might say is entrepreneurial, or you might say it just follows the money. It's kind of a contract for hire for anything a donor wants to do vis-a-vis migration, which is why it's sometimes called a post-imperial actor, promoting the interests of Western developed countries. It expands their sovereignty by kind of promoting their interests vis-a-vis the origin or sending countries for migration. It is considered like a consent generating apparatus. By that, the article means that it appears to be a neutral international organization, but it's really very rooted in Europe and North America and in the interests of those states. It does not really look at the root causes of migration. It acts sometimes as a broker in labor migration. It took the article cites an example of Philippines and Canada in this regard. It's had a troubled relationship with humanitarian actors. The IOM is often the first to want to be involved in humanitarian situations, but it's not trusted and not respected by some of the more purist humanitarian groups because it's seen often to be an agent of the North coming into humanitarian crises in the South. And the article also develops this idea of it being a global migration manager. The article is actually somewhat of a negative depiction of the International Organization for Migration. It also does many things well. It produces excellent information and data on migration, but I think it is safe to say that it's very much been an organization funded and shaped by the northern countries. The next group is civil society organizations. And again, as I said in my announcement, I realize that the video on this was a bit dry, but it's also quite comprehensive and makes some very good distinctions. And the article on this talks about social movements as being more informal groups of individuals or organizations acting towards a common goal. Social movements are characterized by political opportunity, by having reach and resilience, and by the ability to frame and package an issue or a problem in a way that gets broad response and support. Non-governmental organizations are more formal. In the health sector, they would include professional organizations, issue-based groups, disease-based groups, service providers, including in humanitarian situations. So, for instance, the American Public Health Association would be an NGO, Save the Children, Doctors Without Borders, just for a few examples. The article points out a number of challenges with regard to our understanding of the role of civil society in global health policymaking. This would include the range of definitions that are used for NGOs and social movements. The influence on policymaking is not fully understood. Much more work has been done on its work in agenda setting versus policy design and implementation. That the access to power and influence of these organizations is often limited, and there are struggles for funding and stability within NGOs, as well as competition among them. And this often holds issues back and limits their effectiveness because the NGOs are more interested, have to be in some ways, interested in building up themselves and ensuring their own stability than in collaborating. And the last slide just talks about national governments. It may seem a little odd to talk about a national government as a global actor, but both the Essentials of Global Health and the other articles refer to national governments as members of intergovernmental organizations, thereby shaping global policy, negotiators of global frameworks and agreements, defenders of national sovereignty and defining of national sovereignty. Importantly, they're also regulators of civil society action. So what one civil society group or civil society coalition can do in an African or Asian or Latin American country or European country depends very much on what the laws and regulations of that country are vis-a-vis civil society action. We have donors countries that fund civil society action and thereby determine who gets to be the most important or the strongest. And national governments are also providers of health and other services. They set the standards for what, in principle, for what civil society actors can provide. In the video, they talked about 6 characteristics of the state: borders, central government, populations, sovereignty, recognition, and monopoly and the use of force, to give you an idea of what constitutes a state or a national government. And I just want to point out that, remember from last week's readings, national governments were really referred to as the hard drive of global governance. They are the foundation upon which global governance is built. I'll just end this presentation by also recommending to you to read 10 Fixes for Global Health Consulting Malpractice, because we need to think of ourselves as individuals as being global health actors as well, particularly you who are about to join the field. And I think it's important to get that perspective and to be self-critical and reflective on our own behaviors.